So let's start with an easy question. What will be your first question to the panel this afternoon?
I want to talk about health innovation and the role that universities can play in introducing some stronger elements of innovation in our healthcare system, including research, but delivery, clinical work. It's said that in Canada we spend something like $200 billion a year on health, broadly speaking. How much of that $200 billion public investment is allocated to innovation? Idealistically, I'd like to say all of it, 100% of it. But I know that's not true, and it's not easy. But I've been advocating that there needs to be more experimentation with delivery, with some of the clinical side. But on the research side, there's tremendous potential to spur innovation, and that's where the universities, I think, can play a very important role.
In a number of sectors of the innovation debate, if you will, there's been a lot of talk in recent years about the discrepancy between Canadian investments in curiosity-based research and pure research and what comes out in terms of commercialization of Canadian discoveries. To what extent is that an issue for the health sector in Canada, and are there things that we could do in the short term to help improve some of that score?
Boy, that's a really great question. And I wish there was a simple answer, because if there was, we'd be doing more. The truth is, commercialization of research, coming from our universities primarily, is not our strong suit in Canada. Research is one of our strengths, there's no doubt. We have terrific research universities. And not only those universities with medical schools are doing health research, right? The biomedical research complex that surrounds a medical school in a modern university is impressive. But health research goes way beyond that, into the social sciences, health sciences, broadly speaking, and health policy. When it comes to commercialization of research, there is more that can be done. And we can't just point fingers at the health sector. We need to look more broadly at the kinds of collaboration that are necessary. So if there's an area that I'd like to see more of, and it's not any single party's responsibility, is collaboration, because collaboration leads to innovation. We know that. So to see the people within the healthcare sector working more cooperatively, yes, that's desirable, but more cooperatively with people outside the sector, in the research community more broadly, with governments, with the private sector as well. I think this is extremely important. So more collaboration will lead to more commercialization, and we need to find different ways to spur that, but it's no single group's responsibility.
Absolutely agreed. Changing gears a little bit, both of our organizations live at the intersection, if you will, of academic research, public policy, and service delivery. How would you describe that relationship between what goes on at universities and the knowledge that is created there, and those who have to use that knowledge to create evidence-based public policy and a service delivery system that is up with the times and in keeping with the best practices?
Well, first of all, let me say, Graham, I'm a big fan of the IRPP and the research that you do because of the independence of that work. You work closely with leading scholars, but you're working outside of the academy to do so independently, and I think you play a vital role in Canada. The Public Policy Forum is more of a convener, a forum, if you will. We do some research, but quite honestly, our organizations have a lot more room for collaboration, as do many others. I think what our respective organizations can do and have done at their best is serve the role of knowledge translator.
Absolutely.
So there's great research going on in universities, no doubt about it. There's good work being done on the delivery side of healthcare as well. But there's a need on an ongoing basis for groups outside of the systems to translate that into practical applications with positive results and positive outcomes that are measurable. And I think that's where there's a role for non-governmental organizations outside of the system to provide that stimulus, quite honestly.
And if you were to give one piece of advice to each side in terms of something they could do to improve that communication, that line of communication, starting with universities, what can universities do better to encourage that translation from research to public policy?
Well, first of all, I think universities should take policy more seriously. We see research on an interdisciplinary basis in universities that's so profound, both curiosity-driven and applied research. But it would be refreshing, I think, for our major research universities, especially in a field like health, to take health policy more seriously and to focus in on practical applications for policy-driven innovation in the healthcare system. That might require some collaboration, and maybe if there is competition, maybe some healthy competition. So I think there's plenty of scope, and I think some of our leading universities are doing a great job, but there's room for more collaboration right across the university sector.
Mm-hmm. And if we turn to government now, we all, in an era of public engagement, and the Public Policy Forum is a leading actor in convening and research and debate around how we bring citizens into public discourse and public policy. If we looked at the government side, in that era of needing to build public policy in public places in a very transparent way, if you were to give them some advice about how to open that door perhaps a little wider and let the research that is done by universities inside a little farther, how would you encourage them to do that?
By taking a bit of intelligent risk. Sounds so easy, right? But we know that we're living in an era of accountability in government. There's almost like a cult of accountability within government right now that prevents even intelligent risk from taking place. But there needs to be a little, because you can't have innovation without a little bit of experimentation. And so if governments could encourage, empower universities and the public to be more engaged. We know that governments can't have all the answers to questions around health policy. It's too big. And they need to engage non-governmental actors, if you will. That includes universities, but it includes the private sector. It includes the research community. And if we could see a new model of public engagement, Graham, I really believe that governments will be strengthened. There will be shared accountabilities, which means there's less risk for government. And that's the door that I would like to see open, even just a little crack.
Actually, that's an excellent point, because it is one of those places where governments aren't yet good at the collaboration game. Is, in the end, how do you share accountability? How do you share risk? How do you share credit or blame? Mm-hmm. And it is a big step for them, but I agree with you. I think it is one of those steps that has to be taken.
I'll tell you where I see it starting. It's interestingly, it's not at the federal level. It's at what is called the subnational level. It's in the provinces. It's in the Northern Territories, where we see some experimentation going on, where we see a little bit of intelligent risk being taken. Not surprising when you consider that health is now something like 50% of the budgets of most provincial governments. They have to. There's a need to. There's a burning platform that they have to work on. And sometimes that's a driver of innovation as well. But we need to encourage that kind of experimentation even while we try to coordinate it nationally so that we don't have every province going off in different directions that are uncoordinated. There is a role for the federal government. Increasingly, in my view, it's one of coordination.
So if we project that into the future, in 2014, the Health Accord is up for renewal, and there will be an intergovernmental negotiation of some kind, we expect. What do you think would be the ideal approach for universities leading up to that debate? How should they engage, at what levels, at what times, to have the impact they should have or can have on the eventual outcome?
Really good question, and I wish I had a crisp answer for you on that. The debate has already started. In fact, in the last election campaign, the Prime Minister indicated that he would extend the 2014 agreement by at least a year or two, so 2014 becomes less of a hard date than it does an important expiration of a 10-year accord that has already been granted an extension for at least a year or two. But I think we're starting to see unilateral discussions between the federal government and provinces. Whether we'll see an actual national accord or not, or a renewed accord is an interesting question. But I think universities can play a role in their respective provinces in the discussions that are already starting. And that's why I believe that universities can and should take more seriously their role as a platform for discussion of health policy and health innovation.
We're just a few moments away from turning our attention to the panel discussion. Last question, David. What are you expecting from the panelists this afternoon?
Well, I have high expectations for this panel and a high regard for each of the panelists as well. I'm looking for not only a high-level discussion very well-informed discussion about health policy and the role of universities. I know we'll have that, given the caliber of the panelists. But I'm looking for some actionable recommendations that can come forward that can actually be implemented, not only by governments, but by universities and by other partners as well.
And you've been a senior executive, as I mentioned, at 3 major universities in Canada. Given the caliber of the participants in this room, because the panelists all have great expertise to bring to bear, but so too do every single other person sitting in the audience who will be asked to ask some questions, provide some comments. What do you think university presidents are looking for in this discussion? What do you think they're hoping to hear?
Well, I think in their own ways, the executive heads of our universities are struggling to see what their role can be in this whole area. Not just those university presidents whose universities can boast of medical schools, but much more broadly, every university is looking at education, interdisciplinary approaches to health questions. Thankfully, not every university is the same. We don't have a cookie-cutter approach. So there'll be different things that university presidents will be looking for, but I can guarantee you this, that there's an eagerness and there's an appetite on each of their parts to play a role in the dialogue, the national dialogue that is now starting on health in Canada. It's one of our important brands in this country.
David, thank you for your insights.
Okay.
Wonderful to see you.
Great to see you.
That was David Mitchell, President and CEO of the Public Policy Forum located in Ottawa. We're now going to head live to the front of the room for the expert panel discussion on universities and healthcare in Canada.